Hi, I'm Dr. Tirado, your West New York chiropractor, and today's neck pain alert, we're going to be talking about neck pain and chiropractic treatment. Here's an example of a typical patient. She's 42 years old, it's a female. She presents to the office with neck pain that's been present for about 2 months. She says that the pain kind of came on gradually without any particular cause. She typically works at a busy phone answering service over at a shoe store. She works about 48 hours a week, maybe 5 days per week, and she never works weekend. And she says that her pain is actually getting worse and worse, especially by the end of her 8-hour day. She describes the pain like, when I move the wrong way, I get the shooting pain that goes inside my arms. I mean, does that sound familiar? That's almost every single one of my patients. What's really different about every single person is really the unique in each case that must be individually managed. For example, some patients just hate doctors or are extremely anxious about just going to a doctor. I mean, I totally understand that. But that might stem back to maybe a bad experience that they had with a doctor at a very young age, or maybe even more recent they had a bad experience. Nonetheless, the approach used in this type of presentation may be best if it's very reassuring and I explain everything to the patient. For example, like a low force type of manipulation may be best suited for this type of patient, when cracking the neck might not be perfect for this type of person. On the other hand, a different patient may not be happy unless they want me to crack their neck or get a good cracking sound out of their neck. Everybody's completely different. But what's really equally important in both of these cases is that, number one, there's a complete explanation of what's going on with the symptoms, going over possible treatment options, and will the proposed treatment options fit inside this person's busy schedule, maybe even their financial situation. Nonetheless, in both cases, just management actually may include modifying a person's workstation by switching to maybe a headset rather than answering the phone, pinching between their ear and their shoulder, or evaluating the patient at their workstation to check for proper posture at the desk, making sure that the monitor is level with their eyes. All these little modifications can actually take place with a custom treatment plan. Teaching the patient that the movement of the neck and teaching them stretching exercises can be done at work multiple times a day, all can really help this patient from suffering with neck pain. Maybe even use of one of these neck pillows or cervical pillows while they're sleeping at nighttime. May also help calm the nerves and calm the neck muscles while they're sleeping so they wake up comfortably. Maybe even an anti-inflammatory diet, for example, a gluten-free diet, or something that's heavy in omega-3, 6, and 9s to decrease inflammation inside the body. Of course, most of the time, all these approaches don't apply to the particular patient, but these are recommendations that I typically give to my patients. If this is you, then it's probably no mistake that you're watching this video, and if you actually watched up until this point in time, you probably realize that some of this treatment's probably going to be able to help you out from whatever condition you're suffering from. That's why I want you to give me a call. You can call me at 201-453-1555. I want to thank you for listening. My name is Dr. Jason Tirado, your West New York chiropractor. Have a great day.